she has had extensive experience with creating um, like online educational modules and resources for students, which is what Marian will be speaking about with us today. So I'll hand it off to Marian and she can tell us a bit more about that.
Okay, thank you very much, and welcome everyone. So I'm going to talk about creating some educational resources for nursing students, nurses, and other healthcare providers about LGBTQ I2S healthcare. And just before we begin, I do want to acknowledge that Kingston and Queens are situated on the traditional Anishinaabe and Haudenosaunee territory, and really acknowledge that how grateful we are to be able to live, learn, and play on these lands. So Cece's given a bit of an introduction to me and who I am. And so I want to emphasize that I'm an educator and a researcher. And as she said, I've been doing all of this for decades. And I started off as the first patient simulation lab coordinator at Queens in 2005. And so that really threw me into the world of designing simulation curriculum and research focusing on interprofessional education, actually. And then since then, I've been involved at a national level through the CAUSN, which is the Canadian Association of Schools of Nursing, and I helped to develop their certification course for simulation nurse educators. And I also helped develop CanSim, which is the Canadian Alliance of Nurse Educators Using Simulation. And I'll tell you a bit more about that organization. And finally, I'm also the VP of Research for the International Nursing Association for Clinical Simulation in Nursing. And so what that tells you is that I'm very comfortable talking about simulation and virtual simulation, but I'm not an expert on the topic of LGBTQ I2S health or cultural humility that I'm going to be talking to you about today. I'm cisgendered, heterosexual, but I'm learning. And really being part of this SOGI nursing project has really accelerated my learning. And so I'm going to share some of that learning with you and share my experiences in developing this much needed educational resource. As I said, it's for nurses and nursing students, but it's really applicable to all healthcare professionals. So I'll start off by talking a little bit about LGBTQI2S health and healthcare education, talk about the cultural humility approach versus cultural safety, and then focus on the SOGI Nursing Education Project, which is why I was invited here today. So I don't know about your curricula. Currently, there has been a historical lack of LGBTQI2S specific content. And certainly when I was in nursing school, I don't recall having any content at all on this topic. There have been some surveys done of medical and nursing schools, and one study showed there was a median of 5 hours of LGBT content in medical schools in Canada and the US. And another survey showed there were 2 hours devoted to this topic in nursing students in the US. One of my colleagues, Chris Shorthill, who was on the SOGI Nursing Project, did a survey of Canadian BSN programs and found that the content was limited and very inconsistent. So why isn't there more education on this topic in our nursing and medical schools? So particularly with nursing, the surveys that have been done have indicated that there's a lack of nursing faculty that feel prepared to talk on this topic. And it's because they had no education in their formal education either. There's also a lack of nursing faculty who feel comfortable talking about this topic. And again, it's because of lack of knowledge and not wanting to say the inappropriate things if they don't know any better. There's also has been limited opportunities for professional development in this area and lack of curricular policies around the content and what should be included. And so Canadian nursing faculty feel unqualified to teach about LGBTQI2S health and wellness, and more specifically, the transgender, intersex, and gender nonconforming health issues. So I don't know how many of you have seen a gender unicorn or a genderbread man, or I guess it should be a genderbread person, sorry. And so this is really very basic information about some of the terminology, because it's often confused. And so gender identity is one's internal sense of being male or female, or neither of these, or both. And female and women and girl and men and boy are also not necessarily linked to each other, but just common gender identities. The gender expression or presentation is the physical manifestation of your gender identity. So how you dress, how you wear your hair, etc. You're going to present yourself to the world in as identifying with specific genders. The sex assigned at birth, was once thought to be very clear. However, so that is the assignment that is based when a child is born, and people are classified as male or female, and now classified as intersex. And it's based on the combination of the anatomy that's present and the hormones and chromosomes that can be identified. And then finally, the sexual orientation. So this is the physical attraction that someone feels to another individual. And it's important to note that sexual and romantic or emotional attraction can come from a variety of factors that include, but are not limited to, the gender identity or the gender expression, or even the sex assigned at birth. So why is it important for health care professionals to be educated about sexual orientation and gender identity? Well, there's a lot of staggering and disturbing statistics that indicate that compared with their straight and cis counterparts, LGBTQ individuals have higher rates of trauma, homelessness, substance use, mental health issues, and even suicide. And so evidence-informed content needs to be integrated into our curricula to improve health outcomes for this vulnerable population. And so it makes sense that having a better understanding of these health issues and the inequalities would allow healthcare providers the opportunity to reduce barriers that are faced by this population. It's also important for healthcare professionals to provide support and validation, and not to add to the trauma that patients may be experiencing in their lives and in their own homes. And it's also important to assess LGBTQ patients for risk. And so this slide here shows that youth who have had just a few more positive instead of negative experience related to their identities show a significant reduction in suicide attempts. And so this is talking about family rejection, but the attitudes and practices of healthcare providers also contribute to that sense of rejection. And so it's also important for healthcare providers to frame their conversations not assuming that all individuals in these categories are going to end up in a tragic circumstance. And so we need to be positive, and there is a lot of research that shows there's resilience and personal growth that comes from coming out and transitioning and building relationships with their families. And so we want to build on strengths and not just be projecting negative outcomes for these individuals. So recently there was published the Continuum of Cultural Safety model by the Public Health Agency of Canada in their stigma report, and it emphasizes the role of the patient in defining culturally safe practice. And so here, all the things in the yellow circle represent the patient group or community. And then the three approaches on the left, so trauma-informed care, anti-racism, and cultural humility, are what the practitioner needs to bring to their interactions with individuals in order to create a culturally caring interaction. It won't necessarily be culturally safe because only the individual receiving the care can identify that it is culturally safe. The 4 culture care concepts on the right are arranged in a hierarchy, beginning from cultural awareness to cultural sensitivity, cultural competence, and cultural safety. And I'm sure you've all heard these terms used interchangeably in your curricula and also just in general on the internet and that sort of thing. And so these represent what the patient or community needs from healthcare providers, with cultural awareness being the bare minimum, and then the ideal being an interaction of cultural safety. Cultural humility is a broader approach with an expanded definition of diversity, and when practiced well, provides the outcome of creating cultural safety with the client. So this is another model of cultural humility by Ferranda et al. And as I said, it's a broader approach. And this model shows that cultural humility, which is in the middle, occurs in an environment of diversity and where you're recognizing the power imbalances. And healthcare providers can provide culturally humble care by being open to new ideas, by being self-aware of their personal strengths, their limitations, and their values, by actively challenging power dynamics and providing meaningful interactions with their clients, and then finally by being critically self-reflective on how they interact with these clients. The results or consequences of achieving cultural humility are lifelong learning, composed of mutual benefit, empowerment of your clients, partnerships, respect, and then ultimately optimal care for all of your patients. So the SOGI Nursing Project really represented a novel collaboration. And it was started by 3 graduate students that are pictured here, who are subject experts on both cultural humility and gender diversity. And they are Benjamin Carroll, who is a PhD student in the School of Nursing at Queen's, Aaron Ziegler, who was a PhD student at McMaster and is now a assistant professor at Ryerson University, and Chris Shortle at Memorial University, and he was the author of that one of those papers that I was talking about. And because of their interests and their research that was all related to LGBTQ healthcare, they were invited to a CIHR session, a brainstorming session, and they were given funding to move forward a project related to their research, and they had to work together on it. And so their idea was to develop, they recognized the gap in healthcare provider education, and they wanted to develop some relevant educational tools that would support sexual orientation and gender identity education. And their focus was on nursing in this project. However, it's, as I said before, it's applicable to all healthcare providers. And they put out a call for proposals for individuals to help them to create these educational resources. And so that's where I came in. And so along with Dr. Deborah Tragano, who's also at the Queen's University School of Nursing, and Dr. Jane Tyerman, who is at the University of Ottawa, we put in a proposal that we would use the CanSim virtual simulation design process to create the SOGI Nursing Educational Toolkit. And so we have a long history of a highly collaborative approach. We've developed lots of educational resources, simulations across a variety of clinical settings and for novice to expert nurses. And we have extensive experience working with other healthcare providers and interprofessional teams. However, none of us were subject matter experts in this area. And so it was great that we were able to collaborate with Aaron and Chris and Ben. So we were successful with our proposal. And we are members of CanSim, and I mentioned this group before, the Canadian Alliance of Nurse Educators Using Simulation. And this evolved from the Ontario Simulation Alliance that was created after we got a large simulation grant to create a simulation design process. And so there was interest from others across Canada to join on the Ontario Simulation Alliance. And so it made sense to evolve into CanSim. And now we actually have international members from the US and around the world, and we're not going to change our name again. We're going to be CanSim. And we have over 1,000 members, and we create and share resources for nursing education. We have over 70 simulation scenarios that would be used live in the simulation lab, over 40 virtual simulation games, and you can see some of them pictured here to the right. We do professional development courses. We have a research interest group, and we do webinars on different topics related to simulation education. So the objective of this project was to develop, implement, and evaluate an online educational toolkit to provide sexual orientation and gender identity education for nurses and nursing students. So the components of the toolkit aligned with the INACSL standards of best practice for simulation. So that's the International Nursing Association for Clinical Simulation and Learning. And so there are a lot of principles that are important to consider when you're designing simulation. And so we came up with a variety of resources that could be used for pre-simulation preparation. We based all of the virtual simulation games on learning outcomes and created learning outcomes assessment rubrics that could be used pre and post as self-assessments. And through the project, we created 4 virtual simulation games and some mini games. We also lined up resources for remediation based on how the learner responded to their questions in the VSG. And then we also created reflective questions that could be used for debriefing. So for all of you that have participated in simulation, you know that debriefing is a really important part of the simulation. And these topics are quite sensitive, and so we feel that it's really important to have a debriefing for these. However, they're available online, open access, and so people can play the games without being in a class, and so they may not have a formal debriefing. And so that's why it was really important to have these reflective questions so that people could follow up after they've participated in the module. So our innovation focused on key learning outcomes that we came up with in collaboration with the subject matter experts. And so the first was understanding personal assumptions about sexuality and gender. So all of us, regardless of our orientation, need to be self-aware of our own identities and how that impacts our interactions with others. And then the application of principles of cultural humility, because that was our goal, was to educate about cultural humility and how that can improve our interactions with our clients. Creation of a safe space, and then focusing on specific communication strategies to obtain health information relevant to the LGBTQ community. And particularly when we're dealing with sensitive topics like sexual health, that might be a little bit different, and those that are cisgendered and heterosexual might be uncomfortable. So giving them modeling how you ask those questions is very helpful, that people can incorporate these into their practice. So the innovation we proposed was to use the virtual simulation games because we felt they would be an engaging format to demonstrate the application of principles of cultural safety and cultural humility to the nursing care of gender diverse and sexually diverse individuals. So many of you may have played some of the games already, but basically what the games are composed of are video clips, and we tend to film them from the perspective of the nurse interacting with the patient. And so you see the client sitting on the exam table, and you see how they react to how the nurse speaks with them. So they watch the video, and then the video stops and they have to answer a question, and there's 3 responses that they can select from. And then once they make their choice, they'll see another video clip that will show how the client responds to the nurse, and they will receive immediate feedback. A pop-up will, a rationale box will pop up and tell them whether it's the best option or it's not the best choice, and why. So it's really important, whether it's correct or incorrect, that you understand why. So you don't want to be just selecting the correct answer and not understanding why it's the correct answer. So I mentioned we use the CanSim VSG design process, and so it's a very user-friendly process. It's a cost-effective method. We use a GoPro camera and an iPad to do all the filming. And then we use Articulate software, which is available now free to faculty at Queen's. And we have developed a template that we can now use over and over, and simply drop new video clips into it and type in the new text that goes along with it. And then as well, by sharing the games across the country, we are further increasing the cost effectiveness, and we're providing standardized education to nursing students and others across the country. So our development process is, we first had some consultation meetings with our subject matter experts, and not just the 3 that were directly involved in the project. We invited members from Rainbow Health and other organizations to come and help us to define our priorities and to participate on the writing teams. And so we selected 4 priority topics and created 4 writing teams. And so each team came up with the specific learning outcomes for that game and the assessment rubrics, and then created the decision points and the rationale for each of those. And then after that, we wrote the filming scripts that would be used. Next, we had to recruit actors. And we, as much as possible, we were recruiting authentic actors from the LGBTQ community. We also were filming in English and French. We had to create a website to house all of the games and the resources that we were collecting to support the education. So the first game we created was Wolfgang's Story. And so there's only one of the gentlemen is in the story, but this is an actual gay couple. And it's an elderly gay man in the story who has lost his spouse and is dealing with grief. And really, based on the patient's demeanor in the video and his responses to the nurse is prompted to perform a risk assessment for suicide and for substance use. And so it's a really nice to include the elderly perspective, because the nurse uses the term queer in the game, and his reaction is he's frustrated at hearing this word. He explains that it's not a word that he likes to use. He doesn't identify with it. Whereas younger members of the LGBTQ community actually embrace the term queer. And so you again can't make assumptions about individuals' preferences for terms like that. The second game we created was Cody's Story. And this is a story about a transgender youth who's facing issues of sexual safety when he's been outed without his permission, as well as suicide risk. So now we're looking at the suicide risk assessment with a younger person as opposed to the elderly man. Sarah's Story is about a gender diverse female who faces assumptions about her sexual orientation and the possibility of pregnancy. And then the fourth story is Connor's Story. And this is about a transgender male who was misgendered in the waiting room by the receptionist. And then when he goes in to see the nurse practitioner again, he's being called by his birth name. which is a female name. And again, so his frustration is mounting, etc. And so right away, it's interfering with the relationship, the therapeutic relationship that you want to set up with the patient. So we also filmed all of the games in French. So have different names for the stories. We would also like to create a French version of the website because resources in French are much needed, and we just haven't had the capacity yet to translate the entire website into French. But at least we have the games available for our Francophone nursing schools and medical schools to use. So this is a trailer that one of our nursing students made to showcase the 4 VSGs in this series.
Hello, Kate. I'm Jen, the nurse practitioner.
My name is Connor. I've gone through this with the receptionist. Did she not tell you? Because my birth name is Kate, but I go by Connor.
My pronouns are she and her. What are yours?
He and
And do you identify as transgender, non-binary, or something else?
I'm a trans man.
So I'm just going to go ahead and ask you some questions that we ask everybody at these appointments.
Yeah, okay.
Have you been sexually active with men, women, or both?
I've had a girlfriend who was sexually active with for the past 3 years, but I had a boyfriend high school.
I have to admit my knowledge is somewhat limited, but I do know there are community-based resources that might be helpful for an in-person connection, and there's also some trusted websites.
I really appreciate it. I don't really feel right now, but I'm more comfortable.
So it sounds like John was your primary support. Was there anyone else that you and John were close to?
So I think he was my everything. Since we as for friends, since we did a lot of couple things, I haven't really heard from our friends since he died.
So that's our website, www.sojinursing.ca. And I just want to acknowledge that there were some challenges on working on this project. And there were some challenges with getting the funding to Queen's, but that's not really relevant to you. But the really challenging part was recruiting the authentic actors. We did not want to have actors portraying identities that weren't their own. And so we actually did recruit members from the LGBTQ community. And in hindsight, there were actually some challenges related to that because we're asking a vulnerable population to be representing themselves on a national forum. And so we had to be very sensitive to that. And we had a number of actors lined up who dropped out. And so it was for this reason. We were also disappointed that in the lack of diversity that we were able to showcase in our actors. But we were happy with those that we had, but we would have liked to have a little bit more diversity. And then of course, getting French actors was even more challenging and took us a lot longer to do that. The website design was also challenging. We had someone working on that with us, and there are some changes that we want to make to the website. So hopefully we'll be able to make it a little bit more user-friendly for those that are going to be using it in the future. So what we've created is an open access resource. And as far as we know, the website has been accessed already over 775,000 times. And we introduced the course, the embedded course into the Nursing 404 Community Health course at Queen's for nursing. And so all of our 4th year nursing students have completed the course. We also invited them to participate in an evaluation study that's ongoing. And we also have students from Ryerson, University of Ottawa, and Cambrian College who are contributing to that. And so we look forward to seeing the results of that. And we've also invited our graduate nursing students at Queen's to participate. We've had a lot of positive anecdotal feedback from students and also from other educators who are using the course in their nursing programs, particularly because of, well, one, because of the content, but also because of COVID and having to move a lot of their courses online. So to have online accessible content like this was great. So I'm just going to show you, give you a little bit of a tour of the website if this will work. Now, what do you see? You still see the PowerPoint, right?
No, we can see the website.
Oh, you saw the website? Oh, sorry, I jumped too soon. Usually there's a green thing around it when it's sharing. Okay, so there it is. So this is the website. And so we have a number of resources. If you click on them, it'll bring you to a resource. And we also have a tab about us. So this shows the team that created the resources. And this is an academic research page. So if you are looking for papers on topics related to sexual orientation and gender identity, we've grouped them according to topics. So there's a number of papers about cultural humility and cultural competence. And then as you scroll down, there's LGBTQ health and healthcare, transgender health, adolescents, older adults, palliative and end-of-life care, and then healthcare education. And so that if you're writing a paper on the topic, that might be a good place to look to see. And we're trying to continuously update these as well. And then if you want to go to the course itself, this is one of the issues where people are having trouble finding the actual course because the tab is down here. We want to have it a bit more present. So once you get to this page, so this is the course, there are some PowerPoint presentations that Ben has narrated. So this one is on sexual orientation and gender identity. And so these are the presentations that we ask students to watch before they play the games. There's one specifically on cultural humility. And so Ben he did his master's on cultural humility, and he's doing some work in his PhD. So he's the expert on these topics, and so that's why it's nice to have him provide this education. There's also another one about health assessment, so conducting a health assessment. So that might be of interest to you. And then we get into the stories. So Wolfgang's story, Cody's story, Sarah's story, and each of the games are set up the same. So you can see the learning outcomes, you can see the rubric. So this is what the rubric is like. And so you can self-assess, and it will give you a little score. And it's not that it's right or wrong. It's just to help you to move from a novice to a more competent practitioner related to these topics. So understanding your personal assumptions about heterosexism. So I might rate myself as a 2 at this point. And then applying principles of cultural humility. Again, I might rate myself as a 2. But then this one, asking appropriate questions when taking a sexual health history, I might still feel like a novice, and that's okay. And then you get a little report that if you keep this, then you can compare your results after you finish the course. Oops. The game links. You can see there's an English and a French. So we'll take the English one. So we've got Sarah's story. Click on next. You'll see the team funded by CIHR. There's a little bit of an introduction to how the game works and what browsers you want to be using. An accessibility statement. And here, if you enter your name, the student can enter their name if they need to provide proof to their instructor that they've completed the module. And then at the end, once you're finished, you'll be able to print off a certificate with your name on it. So the learning outcomes are repeated here. A little bit of a case summary about the story, and then it goes right
Sarah
into
White.
the game.
Hi, Sarah.
Hi there.
My name's Samantha. I'm going to be the nurse practitioner looking after you today. I'm here just for your intake appointment.
Okay.
Usually in this appointment, we discuss your past medical history and medications, but it looks like you're not actually taking any medications at the moment.
No, I'm not.
Okay. Are there any regular over-the-counter medications that you take?
No.
What about ointments, creams, or birth control pills?
No.
Okay.
And so now the question pops up, what should the NP ask next? And so it will continue with questions, responses, and until the end of the encounter. We also have some debriefing suggestions about different ways. And this is more for the faculty that are using it in a course, so they have ideas about how to do the debriefing. Oh, there's no additional resources on this one. And then here's some of our mini games. So this is a new one about a virtual appointment with a nurse practitioner, and the patient is requesting to be tested for an STI. So that's essentially the website, and it's open access, so you can go on and play the games and use the resources. And if you have any suggestions of resources that should be added, I'm happy to add those for you. So this is one of our newer games, and the individual that's coming to the appointment is actually bisexual. And so understanding it's about understanding your assumptions about heterosexism and monosexuality. So someone in a relationship with more than one individual. And then there's a second virtual simulation game about a bisexual man who's experiencing interpersonal violence. So rather than having the woman, it's a man that's experiencing. Another new game that we've just filmed is about a same-sex couple with a sick child. And then this one would involve assumptions about the partner and not recognizing that they're actually a couple. And then another one involves an inappropriate disclosure. So as a healthcare provider, sometimes you have to share information about someone's sexual orientation and gender identity. But there are other times when it's totally inappropriate and it shouldn't be used as gossip. And so this one involves a healthcare provider sharing information about the individual's sexual orientation and also their HIV status when it's not relevant to the care being provided and the consequences of that. So just a few take-home messages. There is a need for healthcare providers to be educated about the healthcare needs of the LGBTQ I2S population. We support cultural humility as an approach that promotes cultural safety for this population, as well for all populations. And the SOGI Nursing Educational Toolkit is available as an open access resource, and it's an evolving collection of resources and games. They can be incorporated into the healthcare curriculums, or it can be used as professional development for healthcare providers. So someone like myself who did not receive this education in my undergraduate education or even my graduate education can now go back and update myself on this important topic. And I'll just acknowledge the funding that was received from CHR. I also have some funding from CASN for the evaluation portion, and of course, support from Queen's University. So I think we have some time for questions, so I'm happy to entertain your questions.
I have a question actually. Thank you so
Sure.
much for talking with us today.
You're welcome.
So I was just wondering in particular about sort of the measures that you use to evaluate whether the program's having its intended purpose or not. So you mentioned that you do receive like feedback on the certain virtual games, but I was just wondering if there was anything else you kind of looked at to see if there was that intended effect you were looking for.
So the participants in the study will be doing the rubrics pre and post as part of the study. And we also have a cultural humility scale that Cynthia Ferranda developed. So the model that I showed you about cultural humility. So she created a survey, a tool that we're going to see if it has an effect on participants' cultural humility, because we're not going into actual practice to see if it's changed practice. That might be something we can do in the future, but at least if we can change people's attitudes or, make them more open to practicing with cultural humility, then we feel that we've achieved part of the goal for sure.
Thank you.
You're welcome.
Hi, Ryan. I was just gonna ask, is there any, I guess, plan to start incorporating this type of stimulation lab in the Faculty of Nursing or Faculty of Health Sciences at any point?
So it's already been given in the Faculty of School of Nursing in the 4th year. And I've had some inquiries from the 2nd year instructor about incorporating it into the health assessment course. So I think the faculty or the curriculum committee needs to make a decision about where to place it in the curriculum. And I would say that 2nd year would be totally appropriate because they're going into clinical for the first time and they're doing health assessment. And I think introducing it then would be valuable. I was also asked if we could post. There's a Faculty of Health Science EDI resources or something. I'm not sure. I can't remember exactly what the form is, but they want to be able to list it on their resources, and so it should be going up there. I'm very happy to have it adopted into the other programs. I haven't really talked to anybody specifically, but if you know someone that, if you're in those programs and you want it adopted, then just connect me with someone that might be able to make that happen. Because it's a nurse interacting with a patient, but it could be any of you going in. So.
I know that you said that the whole program was developed with help from and insight from members of the LGBTQ community and organizations supporting this topic. But have you received any feedback from the community and like how they feel about this representation, whether they feel it's accurate?
So I had some feedback. We had sent out a flyer, a couple of beautiful flyers that were made by one of our marketing people, and one of the I think we had shared it on Twitter or something, and we got feedback right away about the lack of diversity. It was just a selection of the photos, and we actually had another version that somehow didn't get sent out. So right away we addressed that and sent it out. I can't say that we specifically had any feedback from the community, and maybe that's something we need to go back and do. One of the other things that we were lacking, so LGBTQI2S, 2S is Two-Spirit, and we really wanted to include something about Two-Spirit, but none of our subject matter experts were Two-Spirit, and we reached out, but we were not able to get anyone to help with that area. And as you know, you don't want to nothing about us without us, that principle. So I think we have some other contacts that we may be following up with so that we can be more inclusive. And we don't have anything yet about intersex either. So those are some gaps that we still hope to address in the future.
Thank you.
It looks like that might be it for questions. If anyone has any other questions, feel free to ask. Okay, well, we really appreciate you coming in today, Marian, and speaking with us. I think the work that you're doing is very, very important and meaningful for us all as members of various different healthcare programs. So thank you so much for coming in to speak to us today. I'm sure that everyone has learned a lot from this talk.
Thank you.
So thank you everyone for coming by, and it looks like people are beginning to leave, but we host these speaker series talks every month, so definitely stay tuned for the next one, and yeah, we hope to see you all there.
Bye.
Thank you, Marian. Take care.
You're welcome.